Health Foundation Nepal is a non-profit, non-government organization registered both in the United States of America and in Nepal since 2013. In the United States, we operate from New York, and in Nepal, our head office is located in the Midwestern district called Dang. We also have a branch office in Kathmandu, Nepal. Health Foundation Nepal was established with a mission to promote community-based comprehensive healthcare services in rural communities of Nepal. Our dedicated teams in the United States and in Nepal work in collaboration to run various healthcare and humanitarian programs. Our active health team in Dang includes 3 physicians, a public health officer, and a nurse. We also have a project management committee and more than 20 mother clubs to support our project activities in Dang. Since our establishment in 2013, Health Foundation Nepal has been implementing various community-based health projects in Dang. Some of our current projects in Dang are Childhood Malnutrition Project, Rural Health Clinic, School Health Program, Community Mental Health Program, and Assessment of Chronic Kidney Disease and Heart Diseases. Just within 3 years of establishment, we have also expanded our projects in the Chepang communities in the Chitwan district of Nepal. In collaboration with Lakshmi Pratishthan, we are running a rural health clinic in a Chepang community of Chitwan since 2016. We are also running computer and health literacy programs in 5 different public schools in rural Chitwan. Besides that, we have been actively involved in supporting people affected by different natural disasters like earthquakes and floodings in different portions of the country. All of the HFN services are provided free of cost to the people. Our dedicated health team screens all children under age 5 years for malnutrition. The children with severe malnutrition are enrolled in our home-based nutritional rehabilitation program, are provided with the nutritional supplements, and are monitored for the outcome at their home every 2 weeks until they get back to normal. Active participation of the local people, FCHVs, and the mother group members makes our malnutrition program very effective and sustainable. Please join our efforts to fight against this social disease and help us bring smiles on the innocent faces of the children in rural Nepal. People with serious mental illness have been restrained in chains, placed in iron bar cages, or have been living on the streets in Nepal. Do they deserve that kind of lives? people affected with serious mental illness and their families suffer because of the lack of treatment, widespread stigma, and the nature of the illness itself.
जनरली जस्तो हस्पिटलमा जाने बिरामीहरूमा 25 देखि 35% सम्म बिरामीहरू चाहिँ कुनै न कुनै खालको मानसिक रोगबाट ग्रसित भएको पाइएको हुन्छ र गम्भीर खालका मानसिक रोगहरू चाहिँ 15 देखि 20% सम्म पपुलेसनहरुमा चाहिँ गम्भीर खालको उपचार तुरुन्तै चाहिने खालकै मानसिक रोगहरू चाहिँ देखिन्छ। त्यो निदानको हकमा पनि त्यही नै फिगरहरू मलाई लाग्छ त्यस्तै नै छ यहाँको स्थिति। सरकारको दायित्व अथवा जिम्मेवारीबाट सरकार चाहिँ सधैँ भागेको जस्तो अवस्था देखिन्छ। अनि अहिले पनि तपाईले हेर्नुभयो भने नेपालको स्वास्थ्य बजेटको मलाई लाग्छ 1% भन्दा पनि कम मात्रै मानसिक रोगमा सरकारले पैसा खर्च गर्छ। यसमा अन्य बरु सरकारले भन्दा चाहिँ बेसी बरु गैर सरकारी संस्थाहरू तिनीहरू चाहिँ अलिकति सक्रिय भएको पाइन्छ इभन दाङमा पनि।
With the medical and psychosocial treatments, most of these affected people can live their normal life in the community itself. The sub-regional hospital in Gorahi provides some form of psychosocial counseling to the people affected with domestic violence, but it comes with great patience. People who are able to afford the private service are able to see the only available psychiatrist in Dang, who drives 3 hours from Nepalganj once a week. Health Foundation Nepal has been partnering with the local non-profit organization called Movement for Inspiration Nepal, which has been actively advocating for the much-needed basic care to the people with serious mental illness who have been left out of our society's support systems. We have identified about 20 people spending their lives on the different streets of Dang. People with serious mental illness are spending lives which we can't even imagine. Is there any way these people can get some support and care?
Any kind of work that will help to improve the life of people who suffer from chronic mental health and any other program to develop more human resource are greatly needed at this time. Providing direct care as a medical care is important, but at the same time, providing a psychosocial support, a place for them to stay, helping them to reintegrate back to the society, and also reconnecting back to the family and integrating them back to the society is a very critical part of overall treatment of any individual with mental health problems.
Our local partner already had a plot of land, but what they needed was the financial support and the technical expertise to establish a psychiatric care and rehabilitation center. We decided to step up for the humanitarian cause after witnessing the first-hand account of the devastating situation of the people with serious mental illness in Nepal. With the input from the experts, we drafted a detailed plan for the Psychiatric Rehabilitation Center, the very first such effort in Nepal. We had the enthusiasm and determination, but did not have any existing funds for the project. We started a fundraising campaign using social media and also organized a fundraising dinner in the United States and raised about $15,000. We needed $121,000 to initiate the project, but we were only able to raise $15,000. However, when there is a will, there is a way. We started exploring avenues for local support. The collaborative approach from multiple organizations, local stakeholders, and government agencies made it possible to start the construction of the building for the Psychiatric Care and Rehabilitation Center in Kuirepani, Dang, Nepal. People with serious mental illness who are either homeless, are shackled in chains or locked inside the house will be the first group of people to receive basic human needs in our program. Our local healthcare team will evaluate the residents of the rehabilitation center for basic healthcare once a month. A team of social workers and a nurse will provide daily care. A team of psychiatry certified physicians will provide psychiatric care once a week. The rehabilitation team will coordinate with the local government and the families of the affected people for reintegration and rehabilitation back to the communities once the individuals are better.
Health Foundation Nepal is close to establishing the proposed psychiatric care and rehabilitation center in Nepal. Health Foundation Nepal needs your help to implement this project. We don't spend even a penny for the administrative activities, and we use local resources and utilize the local community people to implement most of our projects. And the funding for our projects comes from membership fee from active members who are still in the early career and are in training like myself. We can establish this community-based mental health project in Nepal.
We are integrating community mental health services in our existing health services in Dang. We have a dedicated volunteer team of psychiatrists and psychologists from America and Nepal to guide our mental health projects.